A delegation of Swedish parliamentarians, together with UNICEF Sweden, visited Uganda to see firsthand how Sweden's partnership with UNICEF and the government of Uganda is transforming children's lives. From hospitals to schools and villages, they witnessed the impact of official development assistance, expanding education, strengthening health systems, and protecting the most vulnerable. At Kawempe National Referral Hospital in Kampala and at Våra General Hospital in Kasese district, the delegation saw how investment in maternal and newborn care is saving lives. With support from Sweden, UNICEF has expanded and equipped neonatal intensive care units, giving premature and sick babies a greater chance to survive, grow, and thrive. In Kasese district, the parliamentarians saw how village health teams provide integrated care at the grassroots, offering immunization, maternal health, nutrition support, health and hygiene education in homes and communities. They witnessed a community-led total sanitation approach with families taking charge of their health and well-being.
If you see it, the home shows you. It shows you what I am teaching, and it tells you that these people whom I am teaching, they pick and do what we tell them, because you can see this home has a toilet, a plate rack, and it has a hand washing facility where we wash our hands after when we are from the toilet. All those are to prevent us from getting diseases.
With Sweden's support, these dedicated community workers bring life-saving care to families in even the most remote villages, ensuring that no child is left behind. While visiting Kamwenge district, a major refugee hosting area, the delegation engaged with local leaders to learn how Sweden and UNICEF are linking humanitarian aid with sustainable development.
Through our integrated social protection programs with the World Food Program, we were able to improve health, nutrition, wash, and education services for both host communities and refugees. This is extremely critical to strike a balance to ensure social cohesion between host populations and refugees.
At Ramwanja Secondary School, they met Uganda's future, its young people. With support from Sweden, UNICEF is helping adolescents build the skills, courage, and confidence they need to succeed. By integrating digital learning, 21st century skills, and menstrual hygiene management, they are empowering young people to think critically, act decisively, and contribute meaningfully to their communities.
I thank this club because it has made me to enjoy, and now I can also be a person in the future. I can be a doctor, I can talk to patients, and for me, my hobby is to become a doctor, and I like playing basketball. Thank you for listening.
The delegates also visited the inpatient therapeutic center at Fort Portal Regional Referral Hospital, where children suffering from severe malnutrition receive care and renewed hope. The visit concluded at Sauti 116, Uganda's National Child Protection Helpline.
Welcome to Sauti 116. How may I help you?
Supported by UNICEF and partners, this toll-free service provides immediate counseling and response for children facing violence, abuse, or neglect, ensuring that no cry for help goes unheard. After days in the field, meeting families, visiting hospitals, and seeing lives transformed, the parliamentarians reflected on what they had seen and why witnessing it firsthand was so important.
Swedish development cooperation is substantial and is making a lot of good around the world. It is important for us who decide about the levels to see what it actually does out in the field.
I think it's very important to see what actually happens with the funds that we grant. Otherwise, it will only be numbers if you don't see what's actually happening.
This is really in the government's agenda that we want the money that Sweden supports Uganda with to reach to the people and to where we have been during these days, and that is wonderful to see.
It's good for me to bring back home arguments to why we should have a generous foreign aid, and it's also good for me to see that the implementations they're going so well.
To see the impact of all the decisions and the work that had been done by people from Sweden, people from Uganda and the governments and also the local people, it is a fantastic thing to see, because it is really showing solidarity, partnership, cooperation.
I was very moved by seeing the results of the Swedish impact, both at the hospitals we were visiting and also the communities. Yesterday, when we were visiting a school where half of the students were refugees, and see how they all work together. They showed us the life skills that they have learned. The students were so creative. I was very impacted by how brave and empowering they were.
There are many good things that are happening here, but we also see the needs. So there are still work to do, but we see that Uganda and the people of Uganda are in a very, very good path forward.
I got very impressed what you can do with when you cooperate and for little money, but I also realized that there are a big helping need. It's a need for more support.
It's especially humbling and rewarding to see the work for maternal and child health when you visit the health centers and hospitals and see the life-saving work. It's always touching. I'm a father of two myself, so I can relate to the vulnerability that they have.
Together, Sweden, UNICEF and the government of Uganda are shaping a future where every child can survive, learn and reach their full potential.